Welcome to the Women's Wellness Center at Lowell General Hospital, where we work as a team to offer comprehensive breast care for women. Located on the second floor of the Mansfield Building at the Lowell General Hospital main campus, our center provides the highest level of screening, treatment, and support services to help women detect cancer in its early stages to provide the best possible outcomes. Thank you for joining us on this virtual tour. Our fellowship-trained breast imaging radiologists use 3D mammography or tomosynthesis as the first line of defense to detect lumps hidden by overlapping breast tissue. Tomosynthesis has been shown to increase the detection rate of breast cancer. At Lowell General Hospital, we offer the most advanced breast imaging technologies you'll find, including 3D imaging, breast MRI, ultrasound, and stereotactic breast biopsy. Now, every woman who has a mammogram at Lowell General Hospital is given an assessment score based on a brief history provided at the start of the mammogram. If a woman is identified as high risk, the Breast Cancer Risk Assessment Program provides an extra level of support, education, and follow-up. Women may also be referred directly to the program by their providers. A team comprised of nurse practitioners, a breast surgeon, a medical oncologist, and breast imaging radiologist work together to discuss recommendations for risk-based breast screening and help develop a care plan based on each woman's individual needs. This program is designed to identify women at higher than average risk of developing breast cancer as indicated through their history and questionnaire provided at their screening mammogram. Women referred to the program receive the appropriate screening and follow-up, and our nurse practitioners design a personalized plan to help patients manage risk factors for breast cancer by reviewing a patient's family history and other risk factors, providing individualized risk assessment, performing a clinical breast exam and instruct patients on how to do a breast self-exam, discussing and offer genetic testing if applicable, providing individualized cancer prevention and screening information, assessing and refer women who are at high risk for developing breast cancer for genetic counseling. All cancer is caused by harmful changes or mutations in a person's genes. Patients may have questions about the risk of other cancers occurring in your body and the risk of cancer developing in your family members. Lowell General Hospital has partnerships to provide fast and convenient genetic testing services for patients who meet the criteria. A quick saliva sample or blood draw is all it takes. The Hereditary Cancer Panel looks for multiple genetic mutations associated with increased cancer risk for 8 different cancers: breast, ovarian, colorectal, endometrial, melanoma, pancreatic, gastric, and prostate for men, and results are usually obtained within 2 weeks. Cancer patients can experience some complications and side effects from the surgical procedures or radiation therapy. Scar tissue and swelling can occur, and in some cases, range of motion can be limited. A serious complication that occurs with cancer patients is a condition known as lymphedema, which happens when lymph nodes are removed because of cancer or targeted with radiation treatment. Kristen Foley is a certified lymphedema therapist who has specialized training to successfully treat and manage lymphedema. Treatment typically involves exercises to make the volume of swelling go down and use of compression wraps. She is excited to treat breast cancer patients at the Women's Wellness Center and be available for on-the-spot consultations.
A lot of patients don't realize that they can get physical therapy following breast cancer treatment, whether it be post-surgery, post-radiation, but there's a lot we can do for the breast tissue and for the shoulder.
When a patient is facing a possible cancer diagnosis, the physician studying blood and tissue samples to make that determination typically goes unseen. To the excitement of many pathologists, that is beginning to change. Lowell General Hospital is one of the first hospitals in the country to bring the practice of pathology out of the shadows. Dr. Lija Joseph, Chief of Pathology and Laboratory Medicine at Lowell General Hospital, is receiving national attention for a patient pathology consult program. a groundbreaking initiative that allows patients into the lab to see their slides and understand how their disease is affecting their body. Located inside the Women's Wellness Center, patients have a safe, comfortable space that is secure and private, where they can look at their biopsies under a microscope, on a computer screen, and/or large flat screen TV. Dr. Joseph began the program in the spring of 2017 and has seen over 100 patients since then, from 13 to 83 years of age. The response to the program has been nothing but positive. Although it may be too much to process for some individuals battling cancer, others are eager to understand their disease at a microscopic level. The program provides an additional resource to patients diagnosed with breast cancer or benign breast changes and is open to all patients who have undergone a biopsy or some type of diagnostic testing. To learn more about the cancer prevention programs at the Women's Wellness Center, please visit www.lowellgeneral.org/breasthealth.